In this video, we're going to be talking about the muscles we use when we run, why strengthening them can help reduce injury risk, including that of overuse injuries, which Achilles tendinopathy is one of those, and giving some ideas of how you can test your strength, and then you can use those ideas as exercises. I'm Ali, I'm one of the physios from treatmyachilles.com. We're an online specialist service treating all sorts of things related to the Achilles tendon. So if you would like to find out a little bit more information about our service or book an appointment, please have a look in the information below. So if we have a look at what the evidence says about strength training is a great way of helping prevent injuries and also treating some injuries. In this video, we're talking about the muscles that are particularly used when we're looking at running and what strength exercises you might be able to do. This is therefore set for people that do not have any injuries and are able to complete those exercises. So if you have got an injury that stops you from doing them, or you're creating any kind of pain or problems after doing these tests, please stop and speak to a clinician and get some advice that's for you. So why do we do the strength training? Well, strength training can show that it can cut the risk of sports injuries by 60 to 70%. If we dial that down into overuse injuries, that overuse injury is a category of an injury that's happened over a period of time, as opposed to with a trauma, an accident, an incident. So something that's come on its own sort of accord, it can cut those injury risks down by 50%. So a tendinopathy or tendonitis is an overuse injury. It typically comes on because we've used it and done some loading and activity on that tissue, that tendon, and it started to become irritated. So the evidence is showing that actually running less and stretching can help manage symptoms, but it's the strength combined with some balance work. And when you have enough strength, looking at more bouncy plyometric exercises with advice on how to do that when you're ready is the best way of preventing these injuries. So looking at our picture here showing all the different muscles that we work when we are running, we're going to run through what they do and talk about them, and then we'll go and have a look at exercises for them. So we have our quads on the front of our leg, and then on the back of our leg, our glutes, our hamstrings, and our calf. We also need to remember we have some work with our hip flexors, our core and upper body, and we use our arms normally when we're swinging those to run as well. To break down a gait pattern can be simply put into two things. Our stance phase, when we take a stand onto that other leg and takes on our weight, and then our swing through phase as we bring the other leg down before we plant it on the floor. And those muscles we spoke about, our quads, they're important in this stance phase as we take our weight, as is the outside hip muscle here, our glute med. Once we do our swing through, we have our push off at the back here from our calf and our Achilles, but also our posterior chain, our hamstring and our glute max. And we swing through and we let our hamstring lengthen as we take our foot down to land, and we use a bit of our hip flexors on that swing through as well. Our core keeps us upright and our arms will move with momentum. If we were to move slightly differently, we will then have a knock-on effect to other areas of our body. So one of a really nice tests to look at is how we line up our hips, our knees, and our toes on a small knee bend. This small knee bend is the same sort of movement that you get when you're walking and running. We can do that on 2 feet, and we can also enhance it and do that on 1 foot. For example, if I was more likely to drop in here, you can see how my load doesn't just drop straight through my body, it drops more in. And that has effect on what I do with my hip, my knee, my ankle, my arch, my toes. And that can tell us, well, if we're doing this movement statically, is it likely that that movement moves on to do that in a walking or running pattern? And it would lead us to think, do we need to look at some strength of those muscle groups? groups. So looking at the posterior chain, we talked about being calf, which we'll come on to in a minute, but particularly our hamstrings and our glutes. A good way of testing those and seeing how our strength is in a lying position like in a bridge. And in that position, we can do a test with 2 legs rolling up and rolling back down. Or we can have a look at a single leg bridge if you're comfortable and able to do so. So to do that, your free leg would be stationary and held in a comfortable position so we don't get the momentum from that leg. Our arms and upper body and head and neck are all nice and relaxed, so we're not pushing through our arms to lift. And we would look for how many times in a sort of 2 seconds down, 2 seconds up kind of speed can we do a repeated single leg bridge on one side compared to the other side. Are our hips nice and level as we lift, or are we dropping one side or the other? Again, this needs to be comfortable, but it is then something that you can use as an exercise afterwards. We're then going to look at our glute med, and our glute med was involved in keeping us upright so we take that step forward in that stance position. A nice test for this, again, you would need a bit of space and a wall. Ideal world, my radiator wouldn't be here, we'd be on a flat wall, but the theory is that your bottom leg is tucked right back. So my bottom heel, my bottom bum cheek and my shoulder blade are all touching this wall. My top heel stays in contact as I lift up as high as I can, and then I lower. And I should not take a few repetitions, but start to feel it working in this area here. Again, this exercise needs to be comfortable, and you're looking for how many, that's 2 seconds up, 2 seconds down, can you do on one side compared to the other to see whether we have any differences. For our quadriceps muscles, so they're the muscles on the front of our thigh, a sit to stand exercise is quite a good one. And what you're looking at is trying to again do that on a single leg as you rise and as you slowly lower back down with control. Again, looking for how many you can do on one side, how many you can do on the other. From the front, you're looking at that alignment that we spoke about with that small knee bend test of hip, knee, toe, all in line. We're not wobbling in or out. Obviously, there might be a little bit of a wobble with this exercise, but we're talking about a pattern of movement. Final test for this would be calves, but as we're talking about this in relation to Achilles tendinopathy and a Treat My Achilles website, the calf exercise would have to be then assessed if you are having Achilles treatments to find out what one is the most comfortable for you. There are a range of different type of calf exercises, from holds with no movement to moving to with weights, off a step, single and double leg, and we've got a variety of videos on those exercises. So our key takeaway is that strengthening the muscles we use to do an activity can help prevent overuse injuries. If we're looking particularly at our running-based muscles, those 3 simple exercises can also be tests to see what you can do and can be used on a regular basis, twice a week or up to 3 times a week, something along those lines, to practice and build up that strength. If you're getting any discomfort or any problems from doing those exercises, or you don't like those ones, there are multiple different choices to do strengthening exercises for those muscle groups. They were just some easier options I can show you at home with no equipment.